Okay, today I will be talking about the career profile for a child life specialist. The organization for child life is the Child Life Council, located in Arlington, Virginia. And with the work environment, while most child life programs are located in hospitals and usually ones with large pediatric departments, child life specialists can work in different settings as well. In order to provide the best possible care for children and families, they need to be located where children will be admitted for treatment in any facility that can house children and provide medical treatment. So some child life specialists even travel to children's schools to give presentations to classmates and talk about the child's recovery, the child's illness, and just kind of pave the way for the child to return to school. Other child life specialists work specifically in one hospital department. Others circulate throughout the hospital. Some of the stressors involved in being a child life specialist are trying to make children and families comfortable under very stressful situations and emotional situations. Often these specialists are dealing with very difficult medical procedures that the children have to undergo, and often they've received difficult news on a diagnosis or prognosis for children, and so providing emotional support under these circumstances can be very taxing. Most child life specialists receive health care coverage through their employers, which are usually hospitals. In addition, the majority of child life specialists have provisions in place for short and long-term disability care, and some have maternity benefits as well. A child life specialist job duties can change every day, obviously, depending on the situation that the child is in and the age of the children that are being served, and just a lot of it has to do with how the child is doing in the procedures and progressing through their care. A child life specialist also continues to provide emotional support during difficult procedures and usually throughout the child's stay at the hospital. A child life specialist also works to make sure that children are on track developmentally during their stay in the hospital. Sometimes this can require activity in groups and other socialization activities where patients can get together and interact. Some activities that specialists are involved in include art and play, where children are allowed to express themselves and feel comfortable maybe talking about some of their anxieties and the stresses that they're feeling through their diagnosis and procedures that perhaps they cannot express verbally. Child life specialists also work with teens in putting on events and programs that encourage socializing, which is a really big thing for teens and something that's important to their development. The educational requirements for a child life specialist. The Child Life Council requires a certified child life specialist to have at least a bachelor's degree or sometimes a master's, generally in a related field such as psychology, human growth and development, education and counseling, and family studies. In addition, they must complete a minimum of 480 hours in a clinical internship under a certified child life specialist, and most require practicum experience before the internship. The final requirement is passing a national examination offered only once a year. Following the certification, a child life specialist must continue to participate in continued professional development to maintain their certification. The starting salary for a child life specialist is about $39,000 to $40,000, and the experienced salary is $43,000 to $54,000. Some miscellaneous information that I learned is that although the majority of child life specialists work in facilities and hospitals that provide pediatric care, an increasing number of openings are available in outpatient facilities. A child's well-being is always a primary care concern of a specialist, but it is usually necessary to involve family members and other support staff in making the experience in a hospital or other facility as normal as possible for a child. And that's it for the child life specialist.